Hello, welcome to 30 Minutes. I'm Rick Anthony. You've probably heard the numbers. 10,000 people a day turn 65 in this country. Most of them, if they take care of themselves, will probably live another 25 or 30 years in relatively good health. If they're adventurous, they'll be able to do things they never ever contemplated before. Of course, we're talking about the 78 million or so baby boomers born between 1946 and 1964. 78 million people who control most of the wealth in this country and still wield tremendous influence over just about every aspect of our life, including these days politics. But what about the boomers in other parts of the world? The older folks who have the same needs, medical attention, socialization, housing, in countries that are not as advanced as the United States, and cultures where taking care of the elderly was still part of the culture. The family took care of them. Of course, that's breaking down. What can those countries learn from what we're experiencing in this country? My guest today, John Whitman, has just recently returned from his second trip to China at the invitation of a business consortium that's interested in satisfying the need and the opportunity for senior housing in that country. Housing and services that are so badly needed by the increasingly aging population. John, welcome to 30 Minutes.
Thank you for having me.
Nice to have you back. You were here a few years ago. We
Yes.
talked about aging, the aging process. Since then, we've both aged.
I did.
More than you. And I've experienced what we talked about then. I know you as an expert in elder care, a consultant, a teacher. You run a nonprofit organization, Trex. We'll talk about that in a moment. And with your wife, you preside over a family of 7 children.
Yes.
How could you possibly leave the country
Well,
for an extended period?
the good news is that the kids are getting a little bit older. I got 3 out of school, 2, 1 in grad school, 2 in college, and only 1 left at home, my baby, who's 2 inches taller than me and 18 years old.
You are going to love being an empty nester.
I don't know. I'm going to miss
Love
it. But this was the time to go. It was kind of a quiet time, and the opportunity experience. My wife was actually jealous; she couldn't go.
Yeah.
So hopefully next trip I'll bring her back.
You were there twice.
I was there twice.
10 days each stretch.
Give or take, yeah.
What did you expect to find when you went over there? Again, I know you're more than intimately familiar with what we're doing in this country, or at least trying to do in this country,
Right.
to reinvent, transform the way we take care of an older population. What did you expect to find when you were in China, and were there any surprises?
Based on my research before I went there, I didn't expect to find a lot in place. I mean, U.S. has been working on senior care services aggressively since Medicare and Medicaid passed in the 60s. So there's been a lot of activity in the U.S. In China, there's really very, very little national policy, and that's part of the reason I went over to try to help structure and set some national policy for them. So I didn't expect to find a lot. The only surprise I found over there was there was not a lot in place of strong family ties to connect. Still there. There's a hospital-centric approach over there where everything has to be done in the hospital, and nothing from a medical skill perspective is done at home. All the home care is just activities of daily living, home care services. The biggest surprise I found, though, is unlike in the U.S., if someone dies from a bad medical call, we sue. In China, apparently they shoot, stab, and beat up the doctor. Seriously, when that happens. That's
what family's all about.
That's right. There's a real violence issue. And you have
Really?
doctors wearing bulletproof vests to work.
Is that right?
Yeah, there's a real issue over there, and it's gotten worse apparently than better. And that is impacting the system to some extent.
But when you say the system, aren't there at least 2 systems, one in the urban areas that have sprung up over the past 15 to 20 years, and then the rest of the country where people are still living in the backwater?
They have a tiered system. They have tier 3 hospitals, which are the highest level, the University of Penn's of the U.S., if you would. They're the high level university type, the best doctors, and that's where a lot of people go, even people from hundreds of miles away. If they're in the rural area with the they'll come to a tier 3 hospital in Beijing or Shanghai because that's where they anticipate getting the best care. And then they have tier 2, which is a step below, and that gets a little bit more rural. And then out in the middle of nowhere, they have the tier 1, which are really clinics.
But the science and practice of gerontology, does it exist there?
It's coming about. There's one hospital in all of Beijing that's a geriatric specialty hospital, so they are starting to get in that, move in that direction. There's the biggest problem I see, though, is the way their system has. There's a number of issues. One is for years they've had the one-child rule,
Right.
which means that's been about 3 decades worth. Which means you could have a husband and a wife, 2 sets of parents and grandparents that legally, not just socially, but legally they're responsible for, and that just doesn't work.
Wait, back up. I didn't know that. Legally, they're responsible?
Legally,
for it?
there's been some laws passed that basically
Really?
say you have the financial obligation, but it can't happen because
Yes.
you can't put that much responsibility on 2 people. So you've got that is one issue. The other issue is this whole hospital-centric approach to care. If you need medications renewed, you have to literally go to the hospital, which are crowded as could be. You get there early in the morning, you register, you pay money to a clerk to register. She identifies the doctor that you should see based on what you tell her the needs are. And you can wait 3, 4, 5, 6 hours, and you get 5 to 10 minutes to see this doctor, who then is supposed to resolve whatever issue you have.
So what does your client in China have in mind to change that?
Yeah, it's
And
actually
is it related to the government or is it private sector?
it's a combination because the government right now has very few regulations. They do have 3 rules or 3 licensing levels. There's a hospital licensing level, there's a home care, and then there's a lower level, kind of non-existent level for a specialty thing that I'm not even going to get into because it's so minimal. But at the home health care level licensure, you're not allowed to pierce the skin. You're not allowed to use any medical device that is used in a hospital, which means blood pressure cuffs, which means
Or
injections.
injections.
Injections. So it really negates the potential of
Yes.
any kind of home health. Well, China's government regulatory process is set up where the central government writes these rules and regulations, but they leave them somewhat general so that the local governments can interpret them as differently as they want. And what's happening now is you're finding some of the local governments are coming back and saying, we don't like that, we're going to interpret it this way, so you can do. So, for example, right now, the average length of stay in a hospital over there is about 20 days for anything, and they're all very crowded. And there's a real push on the part of the government to see more people. So if you can reduce the length of stay,
Yes.
that helps open up more beds. But you can't reduce length of stay now because any of the skilled care services, anything, physical therapy, respiratory therapy, even injections, nursing visits by a skilled care nurse, none of that's being done in the home, so they stay in the hospital. And what this group's trying to do as one of the strategies is work with the hospitals to move these people out on day 10 or 12 and then provide the skilled care services in the home. Now, typical of the U.S., so they have economic issues because there is an insurance program, their version of Medicare, if you would, that pays for the hospital care, but not the home care. So if you go to the family and say, we're going to
Yes.
move your mom home on day
Yes.
10, but now you have to pay for home care, it creates other issues.
But do they have the staff to really build out a home care infrastructure? And technology.
Yeah.
I mean, they steal our technology, so I'm sure they have it, or they'll have it by tomorrow. But what about technology? Is that helping to accelerate the move towards better home care, more pervasive?
It will, but let me hit the staffing issue
Okay.
first, because they do graduate about 1 million nurses a year in China. So there's a very big push for nursing care, but they all work in hospitals. So there's no home care provision at all. So there's a real need to take and transfer those. Now, with people getting shot, stabbed, and beaten up in the hospitals, and they work very hard hours, and their pay is not that strong, and they're not as highly respected as people in the U.S., healthcare workers.
Are these
in the
all
US.
government-run hospitals?
The majority are. In the last couple of years, China's opened up to private hospitals,
okay.
and there are some private companies coming in as well. But anyway, all of that pain, if you would, that's being experienced in the hospitals, make it very ripe to bring people into a home care market if you can pay them appropriately. And you
Yes.
can if you design your model
Yes.
right. So I don't think there's going to be a huge issue moving from hospital to skilled care workers in the home. In fact, there's one company over there now looking at an Uber type of an approach where they could, the
really?
home person can just say, I need a homemaker, I
Yeah.
need a nurse, I need this. And the key in my mind is they have to get the doctor into the home.
Yeah.
Because the doctor has to evaluate and diagnose a patient and has to take more than 5 or 10 minutes to do that. And then once they diagnose the patient, be able to determine you need a nurse to visit you every week, every other week, every third week, once a month, and here's homemaker in the meantime. That's really what you need.
How does a company like your client, privately held, as I understand it,
Right.
for the most part, privately funded, or at least partially funded, How do they expect to make money? What's the revenue model?
Right now it's a private pay model, but the Chinese have money. I mean, the elderly. I mean, there's always that portion of the population that's poor, and most of those are out in the city or out in the
yes.
rural areas.
Right.
In the urban areas, I went to visit a man that he was living in an apartment. You got to understand, like Beijing has 40 million people in Beijing, where I was. So there's people everywhere, high rises everywhere.
Yes.
I went to visit this man in his apartment, and it was a lower end apartment based on what we would look at. So you look at this and think, okay, he's not a very wealthy individual. But you go in, here I found out after the fact he was an ex-government employee, so he had a very good pension. He owned the apartment, which was worth about $500,000 in US dollars, which blew me away,
Yeah.
but that's just the reality of the market. But he was reluctant to spend money for himself in the house because you have this senior mentality that says, I want to leave the money for my kids. But now you got kids that are saying, I'm responsible for my parents. So there's money there to be spent, and there's benefit to having home care type services. Let me give you another simple example. I interviewed a woman whose mom had a stroke. Her mom was a physician, had a stroke 3 years before, almost totally disabled by the stroke. So they had round-the-clock attention for her. They bring these country girls in that are, with little or no education, that just basically do the activities of daily living. One of the problems with that is they have no training. So even simple things like transferring from the bed to the chair, they have people getting hurt because they don't know how to do it right.
In which case there's culpability. I mean, those poor people
They have
can hear from the family as well,
Oh,
right?
absolutely, absolutely. So you got that issue going on. But then what she found, she had to go back to work, so this person was living in the house. And every month or two, her mom was going back to the hospital because there was nobody monitoring her mom for simple things like weight gain, urinary tract infections, simple things that they weren't able to detect and correct at home, escalated into acute care episodes. So the mom had to get transported back almost every 4 to 6 weeks. And they call an ambulance, which they have to pay for out of pocket. There's one driver that comes. They live in a high rise with no elevator, so they have to carry her mom down a stretcher down this narrow stairwell, which was her biggest fear, that they're going to drop my mom. So, and then she goes to the hospital, stays another 20 days, then she comes home. And every 6 weeks she goes back. And it's a system that's just ripe for repair.
In this country and this culture, at least up to now, we at least claim that we value life. And we will do everything we possibly can to extend it, to quality of life and so on. And so it's a value. In the Chinese culture, is there the same value? Is there the same sense of responsibility to do whatever you can to extend life?
I don't think there's
Or at some point do they say, for economic reasons or social reasons or whatever, enough is enough?
There's definitely the respect for life. There's definitely the responsibility to care for mom or dad. The technical side of it, I think, how far you go is not as advanced as we have here in the U.S. And by advanced, I mean, I don't think they do as much. People die because they don't go for the respirator. They don't go. And I'm not sure whether I haven't dug into that enough to know whether that's the family choice or whether that's the health system saying, you're not eligible or available or going to get
My
that.
guess would be as the younger generation, it may become an issue of convenience or economics.
Big issues there. And the other issue with the economics and the family is that a lot of the more successful Chinese that go to school out of the country or even go to good Chinese colleges, they leave and they go to Europe, they go to the U.S. So now you got elderly there and not able. So it was very interesting. I visited 2 nursing homes while I was over there. And nursing homes are not popular there yet because it's sort of like shirking your responsibility.
There's a stigma attached to it.
Yeah, there is. But the people who are going there are the ones where the kids are living out of the area and can't do that personal responsibility. Yeah, it was definitely.
The numbers would certainly suggest that they have a serious problem and they better get to it quickly, according to what I read. Currently 100 million people 60 or 65 and older. By 2050, that number is expected to be 300 million or more than 300 million. Still a relatively small percentage of their total population of 1 something billion.
Yeah, it's getting up to, it will reach 25%, which just the sheer number is huge. And the impact that'll have on their society is going to be huge in terms of the the business models build up around it, and the service care needs that are required, the impact on hospitals. The good news is the government's recognizing that we've got a crisis coming really quick if we don't do something, and they are looking at things that they can do. For example, one of the cities that I visited when I was there is called Chongqing, and it's the southern part of the country. It's really the hub of a lot of the economic growth and government of the country. They gave this company a grant, just an outright grant of $5 million and a beautiful office space. We went to visit the office space. And it's like a high rent district, a beautiful, to start home health care because they recognize the need and they're waiving those requirements I mentioned earlier, recognizing the need for this as a way of preserving the economy and making things grow. So the government's very much concerned, interested, and involved right now in trying to make things better. And there's a lot that can be done. I mean, moving people out of the hospital, making it not hospital-centric and moving it back to the home is a huge opportunity.
You were there because they obviously want to learn from your experience, your extensive experience in this country working with senior living facilities all over the country, all stripes, all levels, and so on. In your judgment, is there an opportunity for them to really learn from our experience, or because they're starting from such a low base themselves, baseline, might they in fact be in a better position to skip all of the inefficiencies, mistakes, and so on we've made and come up with in the long run a better system?
Well, both are hand in hand. They can learn from us by avoiding the mistakes and picking the things that work, and we can help them in the same fashion. I'll give you an example. Right now, their hospital payment system is based on a cost-based DRG type or cost per case type basis. And we found out the hard way after 20 years that that's not the way to go. The way to go appears to be more of a bundle payment, a pot. Here's a pot of money. Take care of Mrs. Jones. I don't care where you do it, how you do it. You just give good quality and get good outcomes. And one of my strong recommendations for China is to get away from the cost per care, the DRG type, the per diem type payment, and move to a performance-based program, which took us 20, 25 years to learn, but sure seems to be the right, because it puts the financial incentives in the right place. For years in the U.S., we've had a program that says, well, Mrs. Jones needs this, but we only pay for this. Okay, so we're going to do this, and it doesn't work. The financial incentives have all been fouled, and this gives them the opportunity to learn from our mistakes, align the financial incentives properly, and thereby avoid a lot of the mistakes we made.
What is the retirement age under their system?
They classify, the group I was with are classifying, and the government officials I spoke to, they look at 60 as being the retirement age. Just a number they've picked. I mean,
Does that mean that people are expected to leave the workforce at 60?
No, they still work past that, but that's the age they're eligible
start
for.
Receiving benefits.
Yeah.
And the benefits include?
The health care benefit right now is they have 52,000 RMB, they call, which is about a 1/6, so that's, I don't know, what's that, about $18,000 a year of U.S. dollars for health care, for hospital benefits. You can blow through that in 1 or 2, 20-day hospital visits, and one if you're having surgery or anything more serious. So it's something. It's not tremendous, and a lot of people go through it, end up having then to pay the rest of it out of pocket.
What is the longevity? What is longevity in China, at least in the urban areas where presumably, well, no, I was going to say life is better, but they can't even breathe over there, for heaven's sake. They can't take a deep breath in those cities.
It's funny, I went to
Beijing
in
some cities.
The first time, and I was fearful of that because I have some respiratory issues of my own, and it was beautiful. I was there in April. It was clear, it was crisp, it was beautiful. Now Beijing, they had the Olympics there 12 years ago, so they took out all of the industry, they took out all the coal burning, if you would. All the motorcycles are electric, they have no gas motorcycles, and they're moving towards gas cars. So it was beautiful. I returned in July, and it wasn't quite as good. It really wasn't terrible yet, but it was. But you go to some other cities like Shanghai, for example, they say it's really bad because they didn't have the Olympics, and therefore a lot of those changes didn't take place. So life expectancy there varies depending on where you are, but it's less than what we have in the U.S. But there's still a very big chunk of people that are between 60 and 85 years old, and as we know here in the U.S., that older age, the older of the elderly, are the ones that consume the most resources.
Are they paying any special attention to dementia and Alzheimer's? Because I would think that as a percentage of the problems, it's got to be increasing.
Yes, but in a limited way. I'll give you an example. There's a lot of neighborhood community type services that are being done there. And they don't have traditional nursing homes, as I said, or very few of them are
Yes.
just really starting. But there's one community I visited have what they call a day hospital program, which is really a nursing home. It's 14 beds in a building next to the clinic. And people come and basically stay there till they pass. And a lot of those are dementia, a lot of those are heavy care patients where family can't take care of them. But the interesting thing is they had 190 applications for 14 beds. So you know the need is there.
Yeah.
And again, because most care is done in the hospital, there's not a lot from a dementia care standpoint being done in the home.
Which country leads, in your opinion, and based on your experience and research, which country leads the world in providing services for older population?
There's, some people debate this, but I think a couple things. Norway and that whole part of the
Yeah, the
Scandinavian
Scandinavian
countries,
yeah.
they've done an excellent job. And one of the things that kind of broke my heart a little bit is they had a great program in place a couple years back. And then when Europe went to the
EU?
yeah, when they broke down the borders and you could travel, they reduced it because they were
Really?
fearful that a lot of seniors from other parts of Europe would
yes,
go to their country and it would bankrupt them. So they ended up.
So they made it less
They
attractive?
made it less attractive, yeah, which was kind of disturbing because they had a great program. But Japan's done a very good job too, and they've had to. They're the forerunners in terms of the numbers.
Yes.
I just reviewed they have a audio animatronic robot type nurse aide over there now that looks, feels, acts. I mean, you'd think it was a real person, and it can do some things, not everything. But it's a companion mainly, which is one of the issues for seniors, particularly isolated.
So they have
seniors.
better home care? Japan?
I believe so right now. I think they've done a better job overall in
Yes.
trying to coordinate it, but I haven't looked at it recently.
Where's India in all of this?
India is probably the same or less than what China is. They have huge numbers. I think the Indian population is probably poorer overall than the
But
China
the culture
population.
supports
They
respect
still
for
support
and
the
taking
respect
care
of
of.
the family, yeah. But one company I know is over there trying to do home health care as well, and it's not getting the traction that you think it would. So you got to remember too, these countries are very steeped in tradition, and what
Yes.
has been is, and changing that, changing from the status quo is very, very difficult.
But the services we provide here, not just in healthcare and so on, are usually in response to demand.
Right.
The market demands them, and presumably they have the money to pay for them. Is that beginning to happen in China, where they're developing their own form of capitalism
Yeah.
and moving away from communism, the old style communism anyway? Is it the more affluent, younger people who are beginning to request, demand services, not for themselves, but for their parents, to be relieved of that responsibility?
I think I interviewed 28 people when I was over there.
What types of people?
These are generally economically sound people. A lot of them were Penn, Wharton graduates who were back over there, alumni. But all middle-aged people, a lot of them have grandparents or parents that they're now dealing with this whole aging care process. And the general consensus from them was, when can I get it? When can you bring it? I mean, their willingness to pay for it was there.
Yeah.
The recognition of the need was there. The recognition of the benefits. If I could have a doctor or a nurse come and visit mom once a week and avoid that hospitalization every 6 weeks because we could catch the issues early, it was overwhelmingly supportive. The issue overall right now is the process isn't quite there in place to make it happen. It's getting close, and it will happen. And there's still, from a U.S. company going to China, one of the things I respect about China is they've come out and said, we don't know how to do this. We've never looked at it. We've never addressed it. So that's why they're reaching out to the U.S. and other countries for support. The problem is if you're a U.S. company coming into China, there's a lot of hesitancy, there's a lot of reluctance because of the trust issues, the intellectual property issues. There's all kinds of just basic business issues that come into play. And that is stagnating or stalling a little bit. But it's going to happen. It's going to happen.
Let's come back to the U.S. for a moment. What is your greatest concern in this country about the future of boomers who are just beginning to enter the system with greater needs for medical care, socialization, housing, appropriate housing, and so I mean, God knows we're not perfect. We haven't been perfect for a long time. Furthermore, it seems to me, some of these institutions are beginning to recognize that the old way doesn't work anymore.
Yeah.
And they're kind of in search for something new and different.
They are.
So we're in a state of flux. In the meantime, the need is there.
The need's there and growing. There's a bunch of answers to that.
Yeah.
There's not just one. One issue is, number one, we need seniors themselves to take a more active part in their care. They need to be more responsive, more patient-centric. They need to understand what they need to do or not do. A lot of our healthcare issues in seniors are because of non-compliance. You know, medication compliance on average is about 65%.
I'm surprised that that's high.
Yeah, which is boggles your mind, doesn't it? But you know, so there's issues like that. There's follow-up with the doctors. There's doing the things you know you're supposed to do. So there's definitely pressure on the part of seniors, and I think more and more seniors, the younger population that's growing up, is recognizing that, and there is more effort. I mean, you see it in the eating habits that are going on, and the changing in diets and exercise. So that's one huge issue. That will have such a major impact on future health care of the individual and costs of the system. The other thing is our system has to change. We are not as hospital-centric as China is, obviously, but we still rely too much on hospitals and higher-end health care, if you would. I think here's a real concern I have. Our long-term care system, our nursing home system, is broken and is going to get broken even further.
Yes.
We're now into a new payment mechanism with Medicare called bundle payments, where a hospital gets a pot of money to care for Mrs. Jones, and they are, unlike before where once they left the hospital, they didn't really care where they went, they had no connection, no tie. Now they're responsible for a 90-day period, so they want to make sure they go to a good nursing home. They want to make sure that the home health agency they use is effective. They want to make sure they reduce, you know, downstream medical expenses. They want to use technology as best they can for monitoring it all. But what that does for the nursing homes is, I'll give you an example. One of the big local community hospitals historically has had 45 nursing homes they've dealt with. When they moved to bundle payment, they narrowed it to 5. Okay.
Wow.
They picked 5 of the best facilities, and they are good facilities.
That they can leverage.
They can leverage, they can work with, they know they're going to take good care, avoid rehospitalizations. And that's good. That's a good change in the system. It's kind of like a disruptive technology, but on the other. But for the 40 that didn't get picked, that means they're going to lose most, if not all, of their Medicare and their managed care patients, which in most states, that's what supports the nursing home. Medicaid pays less than cost.
So we're shrinking capacity?
Well, no, not what's going to happen is you're going to avoid, those 40 homes aren't going to get the higher paying patients, so they're going to fill up with Medicaid patients. Medicaid pays less than cost. So it starts what I refer to as a downward spiral. They can't keep up with salaries, they can't
have the
maintain
readmission
staff,
issue as well.
The readmission issue. And you know, historically we've had that occasionally.
I think I'm getting depressed.
Just
There's no hope for me.
Treat your kids good. Yeah, one of my favorite bumper stickers is "Treat your kids good, they're going to pick your nursing home." But anyway, what that means is we have to redesign how we're doing long-term care, because I don't care what you read or who tells you, we're always going to need facilities for people who are so far gone medically and mentally that total care is all that's left.
Big problem. Big opportunity as well for entrepreneurs and innovators. Thank you very much for being here.
My pleasure.
We'll have you back after you've had a couple of other trips to China, see what progress is being made over there and what lessons you can bring back here.
Sounds good.
Thanks very much for being here.
And I'll let you pick out a nursing home when time comes. I'll help you.
Okay. I went up on a hill.
That's right.
Until next time, this is 30 Minutes. I am Rick Anthony. Take very good care of yourselves.